Hello and welcome to everyone. This is Nasir Ali here. Dear student, in today's tutorial we will talk about the antifungal drugs and classification of antifungal drugs. So without wasting any time, let's proceed our today's lecture from the words antifungal drug. So what is antifungal drugs? Those drugs which kill or destroy fungi are inhibit the growth of fungi is known as antifungal drugs. Those drugs which is responsible for the destruction of fungi and for the inhibition of growth of fungi is known as antifungal drugs. In simple words, people can say that those drugs which have two properties. The first property is that which kill fungi and which stop the growth of fungi, So such a type of drug is known as antifungal drug, which is responsible for the killing of fungi and which is responsible for the inhibition of the growth of fungi or stop growth of fungi is known as antifungal drug, and its example is ketoconazole, hexafungine, and amphotericin B, itraconazole, fluconazole, etc. So these are all the examples of the drugs which is responsible for the destruction, for the killing or the inhibition of the growth of fungi. And this is all about the general introduction and definition of the antifungal drug. Now move forward toward the classification of the antifungal drug. So we can classify antifungal drugs on the basis of their action on the different part of the fungus or the fungi cell. So on these basis, we can classify the antifungal drugs into three main classes: drugs acting on the cell membrane, and drugs acting on the cell wall, and drug acting on the nucleus. So the first class of the antifungal drugs is drug acting on cell membrane. Those drugs which is responsible for the disturbance of the cell membrane of the fungus is known as drug acting on cell membrane. And the example of such type of drug is elilamine, and the example of elilamine is the Terbinafine, nifedipine. The second class is the azole, and its example is the ketoconazole, fluconazole, miconazole, and itraconazole. The third class of drug acting on cell membrane is the Fulene antibiotic, and the example of these type of drug is the amphotericin B, nystatin, and nitamycin. Now, how these drugs are work? What is the mechanism of action of these drugs? We will discuss the detail of these drugs in the next lecture, but in today's lecture, I will give a brief overview about the mechanism of action of these drugs. So, as we people already discussed in the structure of the fungus with respect to pharmacological target, that fungus is pharmacologically consists of the three main parts. The first one is the cell membrane, cell wall, and nucleus. So all antifungal drugs act on cell membrane, on cell wall, or nucleus. So the first class of the antifungal drugs that act on cell membrane and elilamine, terbinafine, and nifedipine, actually working by the inhibition of the squalene epoxidase enzyme, which is responsible for the conversion of squalene into the squalene epoxide, and this squalene epoxide then converted to the lenosterol and then ergosterol, and this ergosterol is then embedded in the cell membrane of the fungal cell wall and provides structural integrity into the fungal cell. So elilamine, like terbinafine, nifedipine, actually bind to this squalene epoxidase enzyme and inhibit the synthesis of squalene epoxide. So when there is the inhibition of the serine epoxide, there is inhibition of lenesterol and the inhibition of the ergosterol, and there is the no structural integrity of the cell membrane of the fungus, so which ultimately leading to the weakening and finally the death of the fungus. So this is the mechanism of action of the elylamine like terbinafine and nifedipine. The second class, the azole antifungal drug like ketoconazole, fluconazole, meconazole, and itraconazole. So azole are actually work by the inhibition of the 14 alpha demethylase enzyme, which is responsible for the conversion of the lenesterol into the ergosterol. So azole are bind to the 14 alpha demethylase enzyme, which is present here and responsible for the conversion of the lenesterol into the ergosterol. So when azole are bind into the 14 alpha demethylase enzyme, leading to the inhibition of the synthesis of the ergosterol. And when there is the inhibition or the stoppage of the synthesis of the ergosterol, there is no formation of ergosterol and there is no structural integrity of the cell membrane and weakening of the cell membrane of the fungus, ultimately leading to the death of the fungus cell. So this is the mechanism of action of the azole. The third class is the foliin antibiotic like amphotericin B, nystatin, and netamycin. So amphotericin B is actually bind to the ergosterol, which is present in the cell membrane of the fungus, and this amphotericin B bind to the ergosterol and form pores or hole in the cell membrane of the fungus. Form pores in the cell membrane of the fungus, and the intracellular contents, like if you consider this is the cell membrane of the fungus. So amphotericin B or fully antibiotic actually form a hole in the cell membrane of the fungus, and the intracellular contents which is present here are leak out from the cell of the fungus and finally leading to the death of the fungi. So this is the mechanism of action of the drug acting on the cell membrane. The second class of the antifungal drugs is drug acting on cell wall. So drug acting on the cell wall, an example is the capsofungin, micofungin, and indolafungin, and these all drugs are act on the cell wall of the fungi. So in the cell wall, in the structure of fungi, we will discuss about the cell wall of the fungi. That cell wall of fungi is actually made of the protein and chitin, and these layers are linked together by beta glucan. This is the layer of the protein, this is the chitin, and these layers are linked together by the beta glucan, and this beta glucan is synthesized by the beta glucan synthesis enzyme, and the cell wall inhibitor is actually bound to this beta glucan synthesis and cause the inhibition of the synthesis of the beta glucan. These cell wall inhibitors are bound to the beta glucan synthesis, leading to the inhibition of the beta glucan synthesis, and when there is no formation of beta glucan synthesis, there is no linkage between the protein and chitin layer, and these protein and chitin layer are separate from each other and leading to the weakening of the fungi cell and ultimately leading to the death of the fungus cell. The third class of the antifungal drugs is drug acting on the nucleus. So drug acting on nucleus, here we will discuss about two main components are part drugs which bind to the microtubule and antimetabolite drugs. So those drugs which bind to the microtubule, and example is the grysofulvin. Let's visit the previous slide. This is the nucleus of the fungus, and there is present the grysofulvin, which is responsible for the separation of the chromosome during cell division. So grysofulvin bind to this microtubule and cause the destruction of this microtubule. So there is no separation of the chromosome during the mitotic division. So grysofulvin is responsible for the inhibition of the growth of the fungal cell. And the second class is the antimetabolite drugs, e.g. flucytosine. So how flucytosine works? Let's visit the structure of the fungus. Flucytosine are enter into the fungus cell through the cytosine specific permease, and responsible for the anti-metabolite mechanism of the, are simply responsible for the inhibition and metabolism of the